Hey guys, long time no see. I've got a couple updates. My school has found 50 of the 200 hours I need in a clinical site. So I need 50 addiction hours and 50 pediatric hours, and they told me it would count towards my addiction hours, but they didn't necessarily say what it was. So I looked up this place that they sent me, and they do like all kinds of things. It says there's counseling and there's housing and case management, and I'm like, okay, that's interesting. Like I don't know what this new preceptor does exactly, but it'll be interesting. So I only need 50 hours with her. She works 32 hours a week. That's approximately a week and a half, and I'm good to go. And that's how I did it. I said, do you mind if I show up every day and just knock this out? She said, no, not at all. So that's essentially what we're doing. So today's Tuesday. I didn't go today because Tuesdays are 4-hour days for her typically. And she had an appointment today, so she just wasn't going to go in for these 4 hours. So that worked out so I can catch up on homework and everything in the meantime. But I did go in yesterday for my first day at this new clinical site. And it's about 40 minutes away from me. And I guess it's a PHP/IOP. And considering most of my nursing is done in the inpatient hospital setting, acute care, ICU, not psych. And then what I have done in psych has been inpatient, forensic, like that type of psych. I basically have no idea how PHPs and IOPs work. So PHP stands for Partial Hospitalization Program, and IOP is Intensive Outpatient Program. And I guess I did not look this up beforehand. I probably should have. But in this setting, at least, it is related to substance use disorders. Patients will find their way to a PHP first, either from a discharge from a hospital setting or from an inpatient psych setting. They'll get discharged to this next step in their sobriety, which is the Partial Hospitalization Program, and they provide housing for patients. For the first 30 days, it sounds like it's pretty strict, like no cell phones, no contact. You're just in your housing and you're in... She didn't describe what exactly they would call the center. It's almost like a rec center. You have your housing, and then you have this other place. And this other place is where they do counseling. It's where the medical staff is, the nurses, the nurse practitioners, and the psychiatric staff as well. And so you're either spending your time in your housing or you're spending your time at this other location. So I am at this other location with the Psych NP. The patients have a little bit of, free will, I guess, when it comes to what they want to do. Like, they have to have so many hours in, but it doesn't have to be an everyday thing, as long as they have, like, a majority of the week spent at group, at, getting checked in on, that type of thing. The Psych NPM with just kind of has open hours. She's there from 8:30 to 3:30, and whenever patients want to stop in, if they need a refill, they just stop in. There are no appointments. If you're part of the program, stop in, tell me what you need, and that's that. So I had a hard time comprehending that at first, because I introduced myself, talked to her a little bit about her background, told her a little bit about my background, and I'm like, okay, like when's our appointment? When do we start? Said, we just wait. We wait until somebody needs to see us. So that was weird. She says that she sees from like 10 to 30 patients a day, depending on the day. I still don't completely understand how maybe some days do get overwhelmed. I don't know. And it sounds like the patients are supposed to keep track of when they have to see her for like a refill, because of the substance use disorders, they only get a week of medicine at a time. They have to go back, check in, talk with the Psych NP, and get another 70 refill. And there's like 2 parts to the Partial Hospitalization Program, and it's the first 30 days, which are very intense. Then you have a second 30 days, which give you a little bit more independence. Maybe you don't need quite as many hours. of group, or you can split your group between like counselors and nursing, and then they graduate from that second step to the outpatient or intensive outpatient program, the IOP. And then at that point, they are looking for jobs in the community and still going to group, still following up. They can have a larger than a 1 week supply of their medication at that point, but they're like reintegrating into society. So it sounds like that's the basics of how this place functions. Still very different. I still feel like I don't understand it, but I'm like that with new things. Like the ICU, it took me a hot minute to figure out like what are we seeing, what kind of patients, what kind of procedures, what does the flow look like? And I think that's the big thing with where I'm at now. It's what does your flow look like? If patients can just come in, what do your visits look like? Some of them are really quick. It was like, hey, I need a refill on my boost bar. And then it was like, well, how are you feeling? Notice any side effects? Sleep's okay? All right, I'll send that into the pharmacy. Granted, she's been there for over 2 years. She knows some of these patients who are part of this program. To me, it's like, who is this patient? Are you suicidal? What was your drug of choice? And I think that the person I'm with already knows this stuff, so she doesn't have to ask it again. It would be very repetitive if she had to ask that each time, and if she sees these people basically on a weekly basis. But it seems so very quick to me. It's like, okay, he needs a refill. Done. Okay, there are certain rules, like they'll get new patients into their program, and that's a full psychiatric assessment. And then every so often they have to check in and kind of reevaluate where things are. Or if something is noticed, like one of the group therapy sessions, they noticed that a patient may have been having delusions, so they recommended that patient come to see the psych NP and get evaluated. So we did talk with that patient. So that's where I'm at right now. I will have 50 out of my 200 hours done, and I still don't have anything in sight for the rest of the 150 hours. I have been trying to be more involved at my state job. So they've been having pharmaceutical reps come and talk with us about new long-acting injectables or long-acting injectables that have been approved for new diagnoses. So I've been showing up to those, and of course those are during the day, so I get to see some of the administrative staff. And they said, hey, did you ever talk to this doctor? And I said, no, I haven't. I've talked to like 5 of them. And they said no, and I just feel like maybe they don't take on NP students. And they're like, maybe talk to this one doctor. And like, he's pretty new, he's pretty open-minded. Just give it a shot before you completely take this hospital off the table. And I was like, all right, you work here, you know that apparently you guys can take NP students, but for some reason the psychiatrists are all saying no. So it gave me a little bit of hope. I'm like, okay, everyone is saying this one doctor will probably take on a student. He's very nice, he's very open. So initially I had put it off for like a week because I'm super down about all the rejection. I'm just tired, a little bit numb. I would just like to sleep. It could just be the winter blues, not getting enough sunshine. I'm just over it. I'm so over it. So I put it off. But then I went to that farm dinner thing and I'm like, fine, I'll email this doctor. I went ahead and emailed him. And he got back to me pretty quickly. He said, nope, sorry, real busy these coming months. So I tried quite a bit. I do need to follow up with another inpatient psych hospital in my area. I got a hold of the director of nursing and she's like, well, I'll talk to my NPs, and I never heard back from her. Do things get busy at those facilities? Absolutely. Should I take that personally? No, probably not. I should just follow up and say, hey, I know things are probably busy. Is anyone willing to take on a student? But also I got a hold of my school and said, hey, I got a hold of this director of nursing. And she said, oh, that's great. We've had students there before. We'll reach out too. And then I never heard anything from my school's point of view from that hospital. So it's not looking promising, but when they do find me places, they're finding me places in like the Akron Fair Lawn area. they're approximately 40 minutes for me, but it's weird that the two places have consistently been in that area, because there's actually quite a few places to choose from in Northeast Ohio, everywhere from Dover, Canton, up to Cleveland, between inpatient hospitals and crisis centers and forensic settings. There are quite a few options to choose from. But some that I've reached out to are just super freaking busy. So I don't know if it is an overwhelm of NP students, because it doesn't seem like there are that many NP programs in the area, or if it's just that they split or like share with residents. I don't know. I can't tell if like the director of this school program is just like from the Akron Fair Lawn area and she knows people, and that's why I keep consistently getting placed, which is why I've been trying to reach out in Canton, because that's where I'm from. I've just been unsuccessful. And I do now feel like there's a bit of a vendetta against NPs at my state job. Oh well, it doesn't matter, because I'll get through it. Pretty soon, I'll be testing, and this will be a distant memory. Just gonna have faith that something is gonna show up. And these 50 hours I'm getting done in like a week and a half, so I will just have to keep my work flexible, and when I do get a place, just get those hours in. That's what was unfortunate about my last place, was that my preceptor only worked 2 days a week, so I did not have the option to just get my hours in. It took me weeks and weeks, months, 2.5 months to finish up those 200 hours. Versus if it's someone like this person works 32 hours a week, so I have that option to just get these hours in. Messes up my actual work, but it is what it is. It's temporary. So besides that, school itself has been fine. We've had a couple case studies due. We've had a couple tests. The tests have been easy. I've got another test today that I'm just going to knock out, because so far I have no reason to believe that there are any curveballs in these tests. They seem very straightforward based on what we're learning about. And actually this week is about addiction medicine, so worked out well for getting my hours in at my clinical site. And then we've got a lot of discussion posts, and those are, honestly, I think they're basically checkboxes. I don't think the instructors care how much thought we put in, at least not at this level. So this is just, the clinical level. It's like, all right, are you talking? Are you communicating? Are you participating with your classmates? That's all we want. It doesn't have to be long. It doesn't have to be extensive. Just get it done. Get it done, you get the points. However, I started looking at the doctorate portion of the program, and I have a feeling I'm not going to be able to skirt by some of the writing prompts as easily. I think they're going to take a much closer look about how that looks. But I'll cross that bridge when I get to it. I'll get through this part first and then worry about that later. So that's what's on my plan for today. I've got today off technically from clinicals. I'll go back in tomorrow at 8:30 a.m. So I'll do my test today. I'll do 2 discussion posts. I got to work out. I got to keep that rolling. Cook some dinner for the week. And that's that. So this preceptor has a much different perspective on her job than my last one. She's a little bit more hands-off, a little bit less. My last one was very specific, I have to do it this way. I have to ask questions in this order, which was good. It was good. It's how she didn't miss anything. And of course, she was flexible enough with the patients if they did have to switch courses a little bit. But this one is just takes more of an interpretive approach. But again, she knows these patients, so maybe that's not the case initially in her assessments. That's just because she knows these patients. But it's honestly a little comforting to know that I basically just have to make sure these patients are okay and figure out how she likes to document and check it off the list. So wish me luck in this next week and a half, and I will give you an update on how it goes. I hope you guys all have a great week, and I'll see you next time. Bye.